Good evening, everyone. I'm Dr. Maitrayee Chennu, consultant obstetrician and gynecologist at Sankhya Hospitals, Hyderabad. So today we are going to be discussing a very important topic, which is hormone replacement therapy in most postmenopausal women. So as I told right now, menopause is a very important phase in a woman's life, and on an average, 1/3 of a woman's lifespan is spent in the postmenopausal period. So it is important to address her concerns and issues. And us as healthcare workers should at least bring awareness in women that they have these options, which can help them to at least alleviate their problems and at least bring them symptomatic relief. And instead of brushing all their symptoms under the carpet, it is important to address them and treat them and give them a better quality of life instead of letting them suffer in silence. So in today's topic, we'll be discussing about what menopause is, the symptoms, and what are the contraindications, when to start, when to stop, and the different management options for menopausal symptoms, which include the hormonal therapy and the non-hormonal therapy. So menopause is defined as it is a retrospective definition. It is the time followed by her final menstrual period, followed by 12 months of amenorrhea. So you cannot define a woman if she just stopped her period like 3-4 months back. So it is a retrospective definition. After she crosses the 1-year period, then only a woman can be labeled as menopausal. So the average age of menopause worldwide is 52 years, which is a little earlier in Indian population, and the range is between 40 to 58 years. So this is the Strauss classification. It is an important tool in which we can grade a woman in which time frame she is in, so that we can start her medication or if hormone therapy is required. So starting from her menarche till she enters into the menopausal transition period, she is in her reproductive cycle. So in that, the periods will be regular. Her hormones also will be at a fluctuating stage. Whereas when she enters into the menopausal transition period, which varies from 2 years to 5 years, it is also known as the climacteric period. So in that period, during the early phase, she might not experience many symptoms, but during the late menopausal transitional perimenopausal phase, she will start experience all the symptoms such as irregular cycles, the hot flashes, her sleep disturbances, weight gain, and all those. So the initial symptoms will happen in the perimenopausal period. And in the after the final menstrual period, that is when we declare her as postmenopausal. And that is later, after 5 to 10 years, the risk of her developing osteoporosis and having cardiovascular diseases and all, they increase, because we all know that estrogen is a cardioprotective, and it also protects the bone density also. So once her estrogen levels drop, she will be at risk in compared to the general population. So this is just a brief slide which discusses how a woman's life is in hormones. So as we see, when her age starts and compared to her age between 40 to 50, we can see a drastic fall in her estrogen and progesterone levels. Comparatively, the testosterone level almost is the same, but when she enters into the postmenopausal period, the testosterone level is high compared to her estrogen and progesterone. That is why we see a lot of women who have facial growth of the hair and all. So that is because of, it's not because the testosterone level is rising, it's just because the estrogen level is far more low compared to the testosterone levels. Okay. So these are two important definitions which one should know, because these are very key important factors which decide in which a woman is required on HRT, hormone replacement therapy, or not. So premature menopause. Premature menopause is the permanent loss of the ovarian function. That means she enters into menopause before the age of 40. It is most commonly seen following surgical menopause, like bilateral oophorectomy. Whereas primary ovarian insufficiency, it describes the loss of ovarian function, same age group before the age of 40 years, but it's not a permanent permanent loss. It can be reversible, very less likely, but it is in premature menopause, it is permanent damage, whereas primary ovarian function, it is only occurs in around 1% of the women. So who are at risk of developing this early menopause? Why are we stressing on early menopause? Is because if a woman's estrogen levels fall down before the age of 40, that means she is at risk of, not having her heart and bones exposed to estrogen for another 5 to 10 years. That means she develops the risk of osteoporosis. She develops the risk of coronary artery disease much earlier in life, and her quality of life also starts to decline at an earlier stage. So it is important to identify these people and counsel them that they have to take a few more medications and all to help them alleviate the symptoms. So what are the risk factors? There are toxic exposures, autoimmune disorders, smoking, chemotherapy, pelvic radiation, genetic abnormalities such as Turner's, or if she has undergone a surgery, ovarian surgery or a hysterectomy. So coming to the next slide, which is the symptoms of menopause. So symptoms of menopause, they include, symptoms of menopause. So the woman initially starts with hot flashes, night sweats, and she also has increased in hair growth, irritability, mood swings, changes in her libido, sleep disturbances, weight gain, skin changes, that the skin starts sagging and the elasticity of the skin also decreases. She also complains of joint pains, vaginal dryness, memory impairment, hair thinning on the head, and loss of bone density. So these are a wide array of symptoms, and each woman is different, and so she will have her certain set of problems. So, but in a general scenario, we can see in stage wise the symptoms of menopause. During her perimenopausal period and during her transition phase, we see a lot of hot flashes and mood swings, decreased libido. Those symptoms would be present in the earlier stage. Whereas in the late postmenopausal period, we see the osteoporosis, heart disease, the urinary tract infections, and depression coming on. This is an important slide which explains how exactly does the estrogen play an important role. So we all know the HPO axis, the hypothalamic pituitary axis. So from the hypothalamus, GnRH is released and it acts on the pituitary, and from the pituitary gland, LH-FSH is decreased, secreted, and it acts on the ovary. From the ovary, estrogen is released and it acts on the various parts of the body, and it also gives a negative feedback to the pituitary gland to stop production of the LH and FSH because there is already enough estrogen. Once a woman enters into the menopause, the estrogen levels, there is no more cells over in the ovary, so the estrogen level decreases. So there is no feedback, and the FSH and LH level increase in the postmenopausal period. This causes all the central effects and the local effects of the estrogen. So the central effects include the vasomotor symptoms such as hot flashes, joint pains. She also has a low sexual desire, and she also is always in a constant state of depression. So these are the central effects. Whereas the local effects of decreased estrogen levels are the urogenital symptoms such as dryness and atrophy. So how do we diagnose that a woman is postmenopausal? So generally, if a woman is healthy over 45 years and she has the following symptoms, she's having symptoms, vasomotor symptoms, irregular cycles, or she did not have the period from the last 12 years, or if the woman is not had a surgical hysterectomy or anything, we do not do any particular tests to make sure that she has entered the menopause, because it is a natural course of a woman's life. We assume that she has entered the menopause. We only do a test when the woman has the symptoms early in her age. So then we use a FSH test to see. So generally FSH more than 30 to 40 is considered to be, if she has the levels more than 30 to 40, then we consider her to be menopausal. So we do not use these all other tests. Okay, AMH, inhibin A, B, estradiol, antifollicular count, ovarian volume, these are not used for diagnosis. Only FSH can be used, but it is not regularly used. And there's another drawback. We cannot use FSH as a diagnostic modality for women who are using any contraceptive pills or any high dose progesterone. If she's taking any hormones, the reverse feedback mechanism will not be there. That means the FSH will be at low volume. So that is, it gives you a false reporting. So we cannot use the FSH levels in these kind of situations. So why do we need to know about the differential diagnosis? So when we are starting a woman on hormones, which do have their own set of side effects, we have to make absolutely sure, we have to be absolutely sure that the woman's symptoms are because of her menopausal status and decreased estrogen levels and not due to other causes. So we will have to know the other causes. So what are the differential diagnosis for the vasomotor symptoms which she's experiencing? We have to make sure she doesn't have hyperthyroidism, pheochromocytoma, any anxiety or psychological symptoms. Whereas if she's having any vaginal dryness or dyspareunia, we have to make sure she doesn't have any vaginal infections such as bacterial vaginosis, yeast infections. If she's in her perimenopausal period and she's complaining of abnormal uterine bleeding, we have to make sure that, we get a physical exam, we do a physical examination and get an ultrasound done and make sure that the woman is not having any fibroids, polyps, we have to rule out cancer, endometrial and cervical cancer. And we also have to rule out that the woman is taking any hormonal treatment like contraceptive pills, or if she's on any progesterone tablet. If she's having any joint pain or any symptoms of osteoporosis, we have to make sure that, her parathyroid levels are in normal. She's not on any steroid therapy, because recently, because of the COVID and all, a lot of women have been on steroid treatments. So for them, the osteoporosis sets in a little early if they're taking it in excess and if it's not regulated properly. So we have to rule out all these conditions before we start her on hormone replacement therapy.